Good morning, everyone. I will get started with this AFC Town Hall, providing some updates on what we've been up to. The format will be John and I will basically have a chat, and you are welcome to put in questions and answers at the bottom of your screen. Please type them in, and hopefully we'll get to them. So I'm going to get us started. Hi, my name is Sacha Urban. I'm Director of Individual Planned Giving at AIDS Foundation Chicago. And I'm so glad you're here. Thank you for joining us and giving us your time and attention. And I hope you're leaving inspired and informed. Without further ado, I want to welcome all of you and introduce John Peller, our fearless leader and CEO, President of AIDS Foundation Chicago. Most of you know John, but John, why don't you introduce yourself really quickly and maybe tell us how we got to AFC, how long you've been here. Let's start with that.
I'm a superstar about muting myself and also not knowing how to unmute. So Keys, could you please stop screen sharing so that we can, everyone can see Sacha's and my beautiful faces? Thank you. So Sacha, thank you for pulling this together today, and thank you to everybody who's joined us. I especially want to thank some of our board members who are tuning in today, and we really appreciate your tremendous leadership of AFC. Of course, thank you to the AFC staff who are just powering the work that we do every day, and some of you have joined us, which is lovely. And of course, our donors and friends who are just give us strength every day and support our work, and we're so grateful for you. Also want to recognize State Rep Yoni Pizer, who is a tremendous supporter of AFC and leader in our community, so thank you. So Sacha, I have been at AFC for 15 years now, which is a long time when I stop to think about it. CEO for since 2014, so that's getting up there too. So I'm just really lucky to have been at AFC and have had so many opportunities to grow and stay engaged, and look forward to creating that environment for other staff at AFC.
Wonderful. So how have you and your partner, David, and Penny Peller, who is your wonderful dog, how have you coped with the pandemic? How have you found joy?
Like everybody, I think we've found strength from each other. That's been so critical. I'm so fortunate to have David to support me and to support each other, and of course Penny, who keeps me going out on walks and getting out.
Yeah.
I've also found lately that being able to go into the office has just given me. It's been wonderful because I've had such a change of pace, and I'm really getting tired of looking at these four walls, as lovely as they are. But you know, we've been doing our best to laugh a lot and just find strength in each other. So
absolutely, yeah. Well, I would like to dive right in, John, and would like to hear from you. How well do you think has AFC responded to the COVID-19 crisis? And what we have heard a lot is, do you think that our community, our AFC community, has been better prepared to handle a viral crisis because of the experience of HIV/AIDS in the 80s and 90s? What are your thoughts?
So I think AFC has responded exceptionally well. Ultimately, it's going to be our clients who make that determination about how well we've responded, and we'll talk more about our response later. But you know, I'm a little bit irked by the comparison between COVID and HIV, and you know, certainly they're both viruses, and both really caused a lot of fear, especially COVID initially. And both have certainly disproportionately impacted Black and Latinx people, and also marginalized people. But I think that's where it ends. And you know, leadership in America was talking about COVID really from the get-go, although it certainly wasn't accurate information, to say the least. But President Reagan didn't say the word AIDS until 1987, which was years into the crisis. The differences, I think, are really stark, and it comes down to stigma. HIV remains incredibly, deeply stigmatized, as it was back then. And I don't think that we've seen the same level of stigma around COVID as we had around HIV back then, or that we really still do today around HIV.
Right, that's a very interesting point, yeah. Now, AFC serves approximately 7,000 clients, and do you feel that clients' needs have shifted? And if yes, how have they shifted? Can you talk about that and what AFC is doing to address those shifted needs?
Absolutely, the needs have shifted tremendously, and it happened, almost from day one of the stay-at-home order. And AFC, along with our partner agencies and with our government partners, was fortunately able to respond right away. And immediately, we turned to doing things like buying people groceries, and we spent thousands of dollars having groceries delivered home to people's homes through a company called Top Box, which was just a lifesaver for so many people who were just afraid to leave their house to do grocery shopping, like so many of us were. We were buying people phone minutes or phones, and continue to do that to make sure that they can stay connected with their case managers, with their friends and families, because social isolation is real and has really devastating consequences for people's health. So I'm so proud that we were able to respond so quickly in that emergency way. Over time, though, as we kind of caught our breath and with our partner agencies figured out what the changing needs were, we quickly realized that paying for rent and utilities was absolutely critical. And we had just launched the new HIV Resource Hub along with our lead partner, Center on Halstead. And we quickly pivoted to providing people emergency rent and food and utility assistance. And so far, we've helped about more than 300 clients with over $500,000 in emergency rent assistance. And we've had clients calling just in tears, absolutely distraught, because they've lost their job and are perhaps about to get evicted. And obviously that has serious health consequences for people living with HIV, having to double up with a family member, or the worst thing is having to live on the streets or in a shelter.
Sure.
And so sometimes folks need several months of help paying their rent. Sometimes they need just a couple $100 to get by. And with the partners at the center, and thanks to support from the city health department, the state health department, we've been able to access federal emergency dollars for COVID to support people. The level of support has I think just been transformational and really life-saving for people who are living with HIV. We've also been able to help people who are vulnerable to HIV and taking PrEP, and that's really a first. And we're one of the few cities in the nation that is helping people who are taking PrEP to remain stable during this pandemic. And we've been able to use flexible city funding to do that. And that story of how we've helped people take PrEP and stay HIV negative is really an important one, I think. We've also been working to support people who are homeless or actively living on the streets or in shelters by housing them temporarily in hotels. And we are just so proud that we were able to pivot quickly, again, along with our many partner agencies, to do this work. We have spent over $350,000 and helped about over 90 clients. As of today, we had 43 people, or earlier this week, we had 43 people staying in hotels, mostly living with HIV. We are fortunately able to connect them with permanent supportive housing and expect long-term to transition those folks, but it's very hard to help people find apartments right now because
Right.
of the continuing COVID restrictions, and that's been very challenging. I think another way that we have helped folks has been as people living with HIV were released from prison and jail, and as I think folks are aware, there was a really bad outbreak of COVID in Cook County Jail, and over 500 of the detainees and over 350 employees at the jail were diagnosed with COVID. And so there was a push to release people who could be released, and people living with HIV were prioritized because of the serious health implications of COVID for people with HIV. So people with HIV were being released in the middle of the night with no support. And so we, along with our partners, again, like the Core Center, Southside Help Center, Transforming Reentry, which is formerly Men and Women Prison Ministries, worked incredibly hard to connect with those folks, to get them phones so we could stay in touch with them, to provide them housing. And we actually experienced situations where clients were staying with their family, but their family said, you know, wait, what, you have COVID? You were in the jail? You can't stay here, and we're kicked out in the middle of the night. And you know, we had to find housing for them, and we rose to the occasion and did it. So just so proud of the work the AFC staff have done, along with our 130 plus case managers out in the community-based organizations, our 14 housing partners, and of course, all of the partners that do policy work.
Yeah, I just was fortunate to work with Bailey Williams, one of our staff members, on a story of a young father who was with the Hotel to Homes program. He was in a hotel with his two young sons for 3 months, and through Clinton, one of AFC's housing navigator, we were able to find him a permanent home on the north side. So do you have a story you can share? Perhaps someone that we helped that was come from the correctional system?
You know, I think the one that really stands out for me is the one that I just shared about the person who was kicked out of their home in the middle of the night. And yeah. So that's the one that sticks in my mind. So
right, yeah. No, it's wonderful we're able to do that. So we understand that the Black and Latino Latinx communities have been most severely affected by COVID-19. We've been talking about that in the news, and they're still the most vulnerable communities when it comes to HIV. Could you talk about this intersectionality a little bit?
Absolutely. So I think what we've seen, and I don't know where I first heard this quote, but it is really has stayed with me, that COVID has really laid bare the injustices that have always been there and made them really visible, that, you know, so many things have been hidden or invisible, and now we have seen them, and hopefully the rest of the country and our leaders have seen them too. As we look at COVID, I just saw some statistics yesterday from Kaiser Family Foundation. The COVID death rate was 3 times greater for Black people and 4 times greater for Latinx people than whites. And that's, you know, pretty close to what we're seeing with HIV, where in Chicago, the rates for HIV are 2.5 times greater for Black males and one time greater for Latinx males than white males. Black females, a staggering 13 times greater than their white female counterparts. And what it comes down to is structural racism. There's no other way to put it. And not just structural racism or institutional racism, but actual racism that is leading to segregation. That means that, you know, hospital and healthcare access is not equal across the city or across the region. And we're finally having national conversations about solutions, and also, of course, local and regional. And we have to say again and again that racism is a public health crisis. And we are not going to fix the public health crisis that we're in right now until we address racism. And No, it's the same for COVID, for HIV, for cancer, for
Right.
diabetes, for asthma. These are all driven, and all situations where we see racial and ethnic disparities. And if we don't talk about racism and how we address it, and also institutional racism, and address the white supremacy culture that is driving these disparities, we really can't make these changes that are needed to address some of these disparities.
Yeah, and I've been with AFC for 3 years now, and I'm very grateful for my own learning about my own racism that I carry with me. And can you talk a little bit about what AFC has done internally to educate the staff about what's going on regarding racism?
Absolutely, we've spent a lot of time working certainly to support staff during the pandemic, and then after the George Floyd murder and the uprisings that followed, we immediately convened an all-staff meeting to talk about how staff were doing and how they were feeling. And it was just so gut-wrenching to hear from parents at AFC, moms, Black women who I work with every day, who just I stand with and am friends with, talk about how every day they fear their Black sons coming home. And that was so gut-wrenching and heartbreaking to hear, and really awakening for me, and I think for so many other white staff. At AFC, I think we're in some ways quite fortunate because we have the Ryan White program, which in some ways is an equalizer and has improved health disparities and health outcomes for people living with HIV who are Black and Latinx. We have housing support for people who are living with HIV, which, again, when you provide someone housing, they're living with HIV, their outcomes just improve so dramatically. So in some ways, we are just tremendously advantaged in the HIV sector because we have these supports that we're able to provide that directly reduce disparities and improve outcomes. But we have tremendous work to do, particularly around PrEP and PrEP access. Mm-hmm. We still have too many people who are Black and Latinx who are getting tested late and getting into treatment late when they have an AIDS diagnosis. So these are some of the work. This is some of the work that we have to do, and that's part of the reason we're leading and co-leading the Getting to Zero Illinois strategy is to address these disparities. As we think about what we're doing internally at AFC, we're launching a racial equity planning process to improve race equity within AFC as an organization, and making sure we're giving all staff an equal opportunity, and doing what we need to do to make sure that everyone is feeling welcomed and loved and embraced as staff at AFC. We're also looking at our own funding at AFC. What are ways that we can increase support to Black and Latinx-led organizations? How can we advocate for more funding from some of our external partners for Black and Latinx-led organizations? And then, of course, I'm doing the work myself of becoming an anti-racist ally. Mm-hmm. Of course, there's always more work to do. Sacha, I think we've had some great conversations about this work, and I participated in a racial healing circle earlier this year, led by TRHT, and highly recommend those for folks if you're interested.
It's definitely becoming an anti-racist ally is definitely a lifelong journey. It's not done by reading a book or attending a seminar. It's lifelong. You talked a little bit about the reaction of AFC supporters to the pandemic, the grant makers. Can you talk a little bit how the reaction has been from the AFC support community?
Absolutely. So we've had, of course, so many individual donors who have just maintained their commitment, and this has increased their commitment. And Sacha, you work with these folks every day. And so we're so grateful that the folks who, in a world where there is so much hurt right now and so much pain and just so much need, we're so grateful for all the people who have continued to make AFC one of their top giving priorities. The response from foundations and corporate partners has been incredible. So many of them said day one, use the money however you need to. They lifted restrictions and said, use the money where you need it most right now. And that flexibility is amazing. The trust that they put in us to use the money where it's going to have the greatest impact is so appreciated. And we have really been able to pivot as a result to meet some of those emergency needs. We also saw some donors create special funds and just work really hard to get money quickly out into the community. The fund in Chicago, led by the Chicago Community Trust and United Way, is a tremendous example of that. And their work to meet the emergency needs was so important and so welcome. But we just need everybody to keep digging deep because the need is still there. And HIV is not going anywhere. We still need to address the needs of people living with HIV in the midst of this pandemic, which is not going to be over anytime soon.
Absolutely. I want to encourage our attendees, if they have any questions, to please put them in the Q&A section. We have a few more minutes, so if you have any burning questions, or just let us know. Can you talk a little bit? Our department is working or used to work right next to policy and advocacy, so we kind of often talk a little bit about what's going on in that regard. So can you talk about what AFC has been doing in policy and advocacy in regards to COVID and HIV on the state and maybe national level?
Yes, the policy work is really probably one of our best levers for creating change as systems and as society, and particularly around race equity. And so the work that team has been doing has just been incredible and is really moving mountains. Early on, we were, of course, advocating for emergency relief from the federal government. And some of that came through the Federal CARES Act for the Ryan White program and for housing. The team worked really hard for policy changes, like making sure people weren't kicked off Medicaid because they didn't return a piece of paper. The state, fortunately, has worked to keep people on Medicaid, keep people on some of the really important HIV assistance programs, like the AIDS Drug Assistance Program, to maintain the continuity of medical care, which is so important right now. And today we're looking at things like telemedicine and thinking, the world has shifted because of, you can now log on from your living room and see your doctor or your therapist or psychiatrist or a specialist. And that wasn't the case before COVID. And all of a sudden, people like insurance companies realized, wow, this is, maybe going to help people get care better. But we have to remember that there are structural barriers in place, and the law in Illinois says that if you're on Medicaid during normal times, you can only get telemedicine paid for if you're in a doctor's office. And you're supposed to go to a doctor's office to talk to a doctor that's somewhere else on the phone, and that's just silly. That doesn't have to be, and that's something that we're, along with many others, looking to change longer term. We're also very concerned that folks are not getting HIV testing, either in the community, in the usual places they would go. Bars aren't really a thing right now, so people, testing that was happening in the community and bars and other community places just isn't happening, and people aren't going to the doctor's office as much. And so we're very concerned that people are going undiagnosed who have HIV and aren't getting into care, or that people who have had HIV for a long time and are would have maybe gotten diagnosed in a doctor's office aren't. So we're really thinking through ways that we can expand access to home-based testing. You can get an HIV test kit in the mail and just swab mail and get your results and get linked to care. Also, home-based STI testing is a thing now. So, you can do swabs yourself and mail them in. And so figuring out ways to pay for those and to create new systems so that those can be available for folks, not just during COVID, but afterwards, because we're all recognizing right now that you don't have to do these things at an office or
Right.
in someone's facility. You can do a lot of these things at home, and it's just as good and easier for folks. So we've got to continue to look at some of those flexibilities.
So that makes me think, John, maybe it's too early to say, but do you think our getting to zero priorities will shift a little bit or just rearrange given what's happening with COVID? Are we still learning? Are we thinking through this? What are your thoughts on that?
That's a great question, Sacha. So AFC, along with our partners at the city and the state health department, launched the Getting to Zero Illinois strategy last May. So it's been coming up on a year and a half. And we have tremendous support from the governor and Mayor Lightfoot. And we are aiming to end the HIV epidemic by 2030. Now, because of COVID, that goal may be pushed out by a year. We are looking at that data. We've also been relying on volunteers from the HIV sector to do some of the work and to lead some of our work groups. And many of them have gotten pulled away into COVID work. And certainly they have tremendous expertise. I think, talk about the similarities between HIV and COVID, the lessons learned from HIV and from, decades of providing HIV care have certainly been brought over to COVID. And many people who work in the HIV sector have also done that work. So we've unfortunately had a bit of a brain drain because of COVID, and hopefully as contact tracing gets set up and launches and funding gets solidified, folks will be able to return to their traditional jobs and traditional work, and we'll be able to resume some of the Getting to Zero Illinois work we'd planned. But that doesn't mean that the work has stopped. It's just happened differently. And so for example, we're working with a group of healthcare providers to do trainings around how to implement routine HIV screening in healthcare settings. And, particularly as we think about the flu season that's coming, as we think about flu symptoms, COVID symptoms, the symptoms of early HIV infection, which looks like the flu, making sure that when someone shows up in the emergency room with flu-like symptoms, making sure they get screened for HIV is an important way to identify, making sure they get screened with HIV is an important way to identify folks. So that's just a taste of some of the important work that's going on.
Yeah, great. Well, thank you so much, John. We're almost out of time. I want to close with two things. Thank you to our attendees. And we are going to put information about Gala and AIDS Run Walk at the final slide. But John, what gives you hope right now? And what are your thoughts for 2021? What worries you? Well, we talked about that mostly, but what gives you hope as well?
So what gives me hope is that we have an election ahead, and it is so important that everybody vote and make sure you're registered to vote. Make sure all of your friends, relatives, contacts, everybody you've ever met is getting out there to vote. And so that's the message that I want to leave everybody with. Vote like your life depends on it, because it truly, truly does, this election and every election. So Sacha, thank you so much for all the work that you've done to put this today's event together.
Oh, thank you for your time. Thank you to Keys, who helped us tremendously with the technology part. So we are very impressed. Thank you, everybody who attended. You can email John or me if you have further questions. If you want to follow up individually, of course, we're here for you. And thank you again. Have a wonderful rest of your day.
Thanks, everybody. Bye-bye.